Hi everybody, welcome to The Cavern. I'm Joel from Vintage Fitness. Going to go over just a little routine for those of you dealing with some low back pain. This routine is especially great for people with sacroiliac pain, SI pain, great for hip issues. It's good for general low back support, but I use it a lot for sort of pelvic and SI problems. So the sacroiliac joints are the two joints right back here. They are part of the pelvic unit and a chronic place for a lot of people, recurring issues for people. So I'm going to show you some simple things you can do at home. I'm going to show you 3 basic exercises, show you a little bit of some variations to those exercises, and then show you how to kind of put it all together. So the first one we want to work on is something called a clamshell. I'm going to show you a couple of versions of the clamshell. Clamshell is nothing more than we're going to lay on our side, okay, on the side, and you can lay nice and flat. Clamshell is simply opening up the knees like a clam, right? So it looks like a clamshell, open and close. So a very beginning movement pattern is just this position here, laying flat on the floor, and we're just opening up. Now, of course, you would do a set of repetitions with the left leg on top, then you'd roll over and do the opposite side. A variation to this, if that gets to be just too easy, is to use a band. Now you can take a longer band and tie it into a little loop like that if you want, or you can use one of these mini bands. They're very convenient. We're going to slip that on and we're going to put that right around our knees. And now the clamshell gets some resistance from the band. And the way I like to do it is, again, in the next phase, we just knock off a nice set of 10 to 15 repetitions. You pick what works for you in the beginning. Try to get to 10. If that's too easy, you can work up to 15, right? We would knock off 10 on one side, and then without a lot of rest, we just go right to the next one and do the next 10 to 15 reps. To up the ante a little more, we'll open up the clamshell and this time pause at the top. Now with the pause, I might shorten the repetitions. So I might not do many more than 10 repetitions because we're going to pause at the top. I like a 3 to 5 second count at the top. So if we open up the clamshell, 1001, 1002, 1003. Return, open up, 1001, 1002, 1003. That's 2. 1001, 1002, 1003. That's 3. Up to 10 reps. Again, you'd roll over and then you do the clamshell on the other side. If you want to up the ante on this one just a little more, I'll take that side posture I'm in and I'll go up to a side plank position, a low plank position. So I've got my forearm braced against the floor. We'll pop up on the knees, and now again we're opening up. And if we open up the clamshell in a nice rhythmical fashion, again 10, 12, 15 reps, whatever you're comfortable with the resistance you're working against. And I would start with, don't start with a real heavy band. Start with something light to medium just to kind of get the feel. If you're going to add another level yet again, you can do the side plank clamshell with the pause. Gets even a little tougher. So we're up here, we open up, 1001, 1002, 1003, that's 1. Open up, 1001, 1002, 1003, that's 2. So with that position, we're not only working the glute medius, getting some glute maximus work, but we're also going to get some core work as well, especially, right around the sides of your trunk that help to support that pelvis and keep everything lined up nicely. Okay, so clamshells, number 1. And I think I told you 3 exercises. I'm actually going to throw 4 at you here. The next one is a classic, just a side leg raise. Let me get in frame here. So we're just going to laying on the side, and we're going to practice raising up and back down. Okay, up and down. Again, in the beginning, when you're a little more acute or a little more recovering from that acute phase, the early phases, your leg alone may be all you need. Okay, and again, we do 10 to 15 repetitions. Then I turn over, go to the other side, 10 to 15 on the opposite side to get myself started. Okay, later, as we get stronger, again, we can go back to the band, and it's really basically the same kind of principle that we did with the clamshell. Now we're using the band to get a little extra resistance, and in the beginning, just a nice rhythmical contraction. Later on, if I get stronger and I want to give it even more oomph, I'll put the pause in there and return. That's 1, right? 1001, 1002, 1003. That's 2. That little extra hold just ups the ante a little more, puts a little more demand on the tissue. Again, we're working at strengthening things like the glute medius, the TFL, that IT band, the glute maximus here. Okay. I don't necessarily do this one in that side plank position. I suppose you could if you want to. I usually just stay nice and flat on the ground, and those are sort of the grades that I go through. Just the leg, banded rhythmical, banded with a hold. Okay, so that's 2 of them. The next one I like for these sacroiliac problems, especially these are really great, especially if it's a recurring problem. You had it seems to get better, and then something happens 6 months, a year later, and you have it again, and it gets better, and then something happens 3 or 4 months later, and it happens again. It's an indication that maybe there's some instability there, some weakness, and we're just trying to sort of tighten everything up and strengthen that musculature around the pelvic region. Okay, the next one is a simple bridge. Most of you have probably done a bridge before. So we're in this position, and basically we're just raising up. I don't like to get too high. Try to avoid, we're not trying to do a full-on back bend. So just a nice straight line. You'll feel the glutes contract, hamstrings are working, okay? Working those glute maximus muscles, and then down, right? So in the beginning, like this, again, we're gonna knock off 10 to 15. In all honesty, I tend to work in sets of 12. That's my personal preference. So, right? So we'll pop up, that's 1. That's 2, right? That's 3, right? So there you go. That's the first initial stage of things. If you want to add a little extra mustard, again, take your band. We're going to put them around our knees here, right? Push out a little bit with the knees, and now raise. So we're getting not only some glute maximus work, we're getting some glute medius work, working on some of those hip rotators as well, right? Similar muscle groups that we used when we did the clamshell. So you're just getting that, you're just pushing the knees out here and holding, and now doing the bridge, okay? That would be the next level up. After that, we'll go into single leg bridges. These are a little tougher, 1 foot at a time, right? And now we're bridging up, and again, I might work 12 repetitions on the right, and then switch it around, 12 repetitions on the left, okay? That's 1 set, all right? If you want to go a little more, again, you can go back to the band, put them on there, extend that one, and now you got just a little bit of resistance from the band as well, okay? So that's sort of the grades with the bridging. The last one I'm going to show you is just the side plank. Side planks are great. Not only are they great for stimulating the glutes, the glute medius, the glute maximus, They're also really great for just helping with that core development. So we're going to work some obliques, we're going to work some abdominal musculature. In the beginning, if you have trouble, what we do is we start out with just some pulsed side planks. So you be in the side plank position. We're just going to plank up and touch down. Plank up, touch down. Plank up, touch down, right? Again, maybe we do 10 or 12 of those, roll over to the other side, do 10 or 12 on the other side. If for some reason that's just too difficult, to make it a little easier, you can do the modified side plank. Here's where this was similar to when we did the clamshell earlier. You're just going to do it from the bent knee position and side plank here, drop, side plank, drop, okay? If you want to make it a little harder, now we're just going to hold the top position for just a count of 3 again, right? So again, pop up, and we'll go 1001, 1002, 1003, right? That's 1. Pop up, 1001, 1002, 1003. That's 2. That's how you count them out. Again, you could do 10 or 12 of those. If you want to crank it up just a little more, what I'll do from there is actually hold the side plank for a timed amount of time. Generally, I try to hit a 30-second hold time. So you set your timer, whether it's on your watch or your gym boss or what have you. Pop up, boom, count it out to 30 seconds. Relax, turn over, bang, do the next one, count it out, 30 seconds, bang. And that would be the sort of the top end of things on that exercise. All right, so this is how I put it together. I usually like to do this as like a circuit. So I'll do each exercise one time through and then take a rest. And then if I wanted to do a second or even a third set. In the beginning, maybe you just start with just one set just to see how you feel. If that feels doable, then you can add a second set. I generally don't do any more than 4 sets. I might do 4 and just rest like maybe 2 minutes between sets. In between exercises, I just kind of go. I just kind of flow from one exercise to the other. So you'd start out maybe with the clamshell, right? Do 12 reps one side, roll to the other, 12 reps the other side, whichever version of the clamshell you choose. If you're just getting started, start with the easy sets, and then you can upgrade them as you feel capable. So then after the clamshell, go to the side leg raises. I don't really rest much because as I'm working one side, right, the other side's resting. So I'll just go right to the side leg raise, knock out my 12 reps, roll back to the other side, knock out 12 more reps on that side, right? Then I'll go right into the bridging, knock out my 12 reps of bridge, and then I will finish off with some side planks, however I choose to do that one, whether it's by rep or by time. That is one set. Once you've done all that, that's one set. So it's a circuit, right? You're just going from one exercise to the next, bing, bang, boom, get to the end of the circuit, take a little rest, give yourself a minute, 2, 3 minutes. If you want to do another set, then add another set after that. So you want to be controlled. I don't want you to rush through the exercises. What I'm saying is you just kind of flow from one exercise to the next, but don't rush the repetitions. Be under control, okay? Herky-jerky movements are what get people in trouble, so keep it slower, under control, and go through your circuit, see how you feel. If you're feeling like you're able to go on and do a second or third or even a fourth circuit, go for it. I think what you'll find is by the third or fourth circuit, you're starting to feel a pretty good burn in, especially in the glute area, the glute medius, the glute maximus. So there you go. That's a simple routine you can do for, in particular, sacroiliac type problems, hip, pelvic type problems. Give this a try. It's not going to fix you in one shot, so be patient. Give it 2 to 3 workouts a week. I would at least get 2 a week. If you can get a third, great. Try not to do them back to back to back days. Give yourself a day off in between. The rest day is important. It gives you a chance to get some feedback and see how you're feeling, especially if you get any soreness. It's good to give yourself a day to recover a little bit. But try to get them in 2 to 3 times a week. Give yourself a good 30 to 60 days of workouts, right? So time length, right? So every other day, say, for 8 weeks, and see where you're at that point. See if things are starting to feel a little more stable and a little better. If you are starting to see some changes, it may not be perfection, but you'll see that you're making headway and you're getting there. Okay, so keep working at it. I'm Joel. This is The Cavern, Vintage Fitness. Check back for some other videos. Thanks. See you.